Antimicrobial resistance is a major global health issue that is rapidly growing in scale and severity. It threatens to undermine decades of progress in treating infectious diseases, which could have devastating consequences for human health and development around the world. The map on this slide illustrates the widespread prevalence of antimicrobial resistance, with many countries highlighted in red, indicating high levels of this problem. The ominous lighting and tone convey the serious and threatening nature of this global challenge. It's crucial that we raise awareness of antimicrobial resistance and take urgent action to address this threat before it spirals out of control. Antimicrobial resistance, or AMR, is a serious issue where microbes like bacteria, viruses, and fungi become resistant to the drugs designed to kill them. This makes infections much harder to treat, as our usual antibiotics, antifungals, and antivirals become less effective. AMR is a growing global health crisis that poses a major threat to modern medicine and our ability to fight infectious diseases. The inability to effectively treat infections is a major concern as AMR spreads. We must address this issue to ensure we can continue to effectively treat infections in the future. The history of antimicrobial discovery and use is a remarkable journey, reflecting scientific advancement and the complex relationship between humans and microorganisms. Early efforts focused on preventing infections through the use of antiseptics. The discovery of penicillin by Alexander Fleming was an accidental but pivotal moment, ushering in the antibiotic era where infectious diseases could be effectively treated. The widespread use of antibiotics after World War II led to significant improvements in public health, but also contributed to the emergence of antimicrobial resistance, a growing global threat. We must continue to navigate this complex landscape, balancing the benefits of antimicrobials with the need to address the challenge of resistant microbes. Antimicrobial resistance is a serious and growing global health threat. Microbes have naturally developed resistance to various substances over time through evolution. However, the widespread use of antimicrobials in medicine, agriculture, and other areas has accelerated the emergence and spread of resistant microbes. Antimicrobials create a selective pressure that favors the survival and reproduction of resistant microbes. This has led to the rise of dangerous, hard-to-treat infections that pose a major challenge to public health. It's critical that we take action to address this issue and preserve the effectiveness of our antimicrobial treatments. Antimicrobial resistance is a growing global health challenge, with bacteria developing various mechanisms to evade the effects of antibiotics. One key mechanism is target site modification. Mutations in bacterial genes can alter the structure of drug targets, preventing antibiotics from binding effectively. Another mechanism is increased efflux, where bacteria develop ways to actively pump out antibiotics, reducing their concentration inside the cell. Bacteria can also produce enzymes that chemically modify antibiotics, rendering them inactive through enzymatic inactivation. Decreased permeability, where changes in the bacterial cell wall or membrane hinder antibiotic entry into the cell, is another resistance mechanism. Understanding these diverse resistance mechanisms is crucial for developing new antimicrobial strategies and addressing this critical public health issue. Antimicrobial resistance is a growing global threat, driven by a variety of factors. One key driver is the overuse of antimicrobials in agricultural settings, especially for growth promotion in livestock production. This contributes to the development of resistant microbes. Problematic healthcare practices, such as overuse and inappropriate prescribing of antibiotics, as well as poor infection control, are also major contributors to resistance. The ease with which resistant microbes can spread globally through travel and trade of food, animals, and people is another significant driver. Individual human behaviors like self-medication, non-adherence to antibiotic courses, and lack of access to clean water and sanitation also play a role in the rise of antimicrobial resistance. Addressing these diverse drivers will be crucial to combating this critical public health challenge. Antimicrobial resistance is a major global health challenge, driven by the overuse and misuse of antimicrobials like antibiotics. Inappropriate prescribing, such as giving antibiotics for viral infections that don't respond to them, is a key contributor. Failing to complete full courses of antimicrobial treatment can also lead to the development of resistant bacteria. The data shows that only 40% of antimicrobial use is appropriate, while 35% is overuse and 25% is misuse. Addressing this issue requires education, improved prescribing practices, and policies to ensure responsible antimicrobial use. Developing new antibiotics is a lengthy and costly process, often taking many years and significant investment. Profit margins for antibiotics tend to be low due to the need for short treatment courses, which reduces the financial incentives for pharmaceutical companies to invest in this area. In recent years, the pharmaceutical industry has reduced its investment in antimicrobial research as the focus has shifted towards more profitable areas like chronic disease treatments. This decline in antimicrobial research and development is a concerning trend, as we need new antibiotics to address the growing threat of antimicrobial resistance. Antimicrobial resistance is a major global health challenge that affects individuals, healthcare systems, and economies worldwide. It leads to increased rates of illness and death as infections become harder to treat effectively. Treating resistant infections requires more expensive and complex therapies, driving up healthcare costs. Antimicrobial resistance also threatens the foundation of modern medicine, putting procedures like cancer treatment, organ transplants, and routine surgeries at risk. These far-reaching impacts highlight the urgent need to address this growing threat through improved antimicrobial stewardship, infection prevention, and the development of new antimicrobial treatments. Antimicrobial resistance is a serious global health threat that prolongs infections and increases the risk of complications, hospitalizations, and even death. Resistant infections are often more difficult to treat, leading to longer hospital stays and higher healthcare costs for patients and the healthcare system. Morbidity refers to the increased illness, complications, and disability caused by resistant infections. Mortality refers to the increased risk of death from these resistant infections that are harder to treat effectively. The image on this slide conveys the sadness, vulnerability, and pain experienced by a patient suffering from a serious infection in a clinical hospital setting. The graph on this slide shows the significant financial impact of antimicrobial resistance on healthcare costs in the United States. The key statistics highlighted are: the economic impact is estimated at $7 billion. Hospital stays are 20% longer and require more intensive care, leading to higher costs. New drugs are often more expensive, and treatment regimens are longer. Reduced productivity due to illness and disability contributes 50% to the economic burden. These numbers illustrate how antimicrobial resistance is placing a major financial strain on individuals, healthcare systems, and the overall economy. The colorful bar chart visually conveys the scale and severity of the problem in an impactful way. I will use these statistics and insights to emphasize the urgent need to address antimicrobial resistance and its far-reaching consequences. Antimicrobial resistance is weakening the effectiveness of treatments for common infections like pneumonia, urinary tract infections, and bloodstream infections. Antibiotics are essential for preventing post-operative infections and allowing surgical procedures to be performed safely. Patients undergoing chemotherapy and other cancer treatments are more vulnerable to infections, so antibiotics are crucial for their survival. Antibiotics are vital for suppressing the immune system during organ transplants, preventing rejection, and allowing the new organ to take hold. The global spread of resistant pathogens is a major threat to worldwide health. Factors like increased travel, trade, and migration allow these pathogens to easily move around the world. Travelers, tourists, and immigrants can unknowingly carry resistant bacteria or viruses to new locations. The interconnectedness of healthcare systems also contributes to the spread, as healthcare workers can inadvertently transmit resistant pathogens. Sharing of medical equipment and pharmaceuticals can also introduce resistant organisms into new environments. This global connectivity means resistant pathogens can rapidly proliferate and become a global health crisis. Healthcare settings like hospitals and clinics contribute to antimicrobial resistance due to frequent antimicrobial use and potential transmission of resistant microbes. The widespread use of antimicrobials in livestock and poultry production has driven the emergence of resistant bacteria in agricultural environments. Dense populations and increased antibiotic use in urban areas can contribute to the spread of antimicrobial resistance. Limited access to clean water, sanitation, and healthcare in developing countries contributes to the burden of antimicrobial resistance. Surveillance systems are critical for monitoring antimicrobial resistance patterns, drug use, and infection rates. Analyzing the collected data helps us identify trends, understand the extent of resistance, and inform public health strategies to address this growing threat. Disseminating the results to key stakeholders, including healthcare providers, policymakers, and the public, is crucial to raising awareness and driving necessary action. Effective surveillance and monitoring efforts are the foundation for a comprehensive approach to combating antimicrobial resistance. Antimicrobial stewardship programs are critical for optimizing the use of antibiotics in healthcare settings. These programs focus on ensuring antibiotics are used appropriately and effectively to improve patient outcomes. A key goal is to reduce unnecessary antibiotic use, which helps minimize the development and spread of antibiotic resistance. By promoting appropriate antibiotic use, stewardship programs enhance the overall effectiveness of these important medications. Healthcare teams must work together to implement robust stewardship initiatives that benefit both individual patients and the broader community. Infection prevention and control is critical for maintaining public health and safety. Key strategies include hand hygiene, environmental cleaning, isolation protocols, and vaccination. Hand hygiene with soap and water or alcohol-based rubs is essential to stop the spread of infections. Regular cleaning and disinfection of healthcare facilities, public spaces, and homes can reduce the presence of pathogens. Isolation measures like contact, airborne, and droplet precautions help prevent the transmission of highly contagious diseases. Vaccines are a highly effective way to develop immunity and reduce the spread of infections. All of these strategies work together to protect individuals and communities from the harmful effects of infectious diseases. Antimicrobial resistance is a growing threat that requires action on multiple fronts. Educating patients about the importance of using antimicrobials appropriately is crucial to combat this issue. Healthcare professionals must adhere to guidelines when prescribing antimicrobials to ensure they are used judiciously. Simple infection prevention measures like hand washing and vaccination can go a long way in reducing the need for antimicrobials. By taking a comprehensive approach that involves both patients and providers, we can promote more appropriate antimicrobial use and combat the rise of resistance. New antimicrobial development is critical as resistance to existing drugs continues to grow. We'll explore 3 promising strategies for developing new antimicrobial treatments. First, identifying novel bacterial targets like enzymes could lead to effective new antimicrobials. Second, repurposing existing drugs originally developed for other diseases may help combat resistant pathogens. Finally, genetically engineering bacteria to produce antimicrobial compounds or target-resistant microbes is a cutting-edge approach. These innovative strategies hold great potential to address the growing threat of antimicrobial resistance. Phage therapy is an innovative approach that uses viruses called bacteriophages to target and kill specific bacteria. This can be an effective alternative to traditional antibiotics, especially for drug-resistant infections. Other promising strategies to address the antibiotic resistance crisis include developing new antibiotic drugs, modifying and optimizing existing antibiotic medications, exploring immunotherapies that harness the body's own immune system to fight infections. The slide image conveys a sense of hope and innovation in the lab setting, which aligns well with the potential of these alternative approaches. The rapid diagnostic tests, RDTs, we're discussing play a crucial role in combating antimicrobial resistance. RDTs provide timely and accurate information about resistance patterns, which is essential for making informed treatment decisions. One key advantage of RDTs is their speed. They can deliver results within hours, compared to traditional culture-based methods that take days. RDTs also offer high accuracy in detecting resistance, helping to guide treatment and prevent unnecessary antibiotic use. Additionally, RDTs can be cost-effective, especially when you consider the potential savings from avoiding unnecessary antibiotic prescriptions. The portability and ease of use of RDTs enable point-of-care testing, which is crucial for making timely decisions about antibiotic treatment. The One Health approach recognizes that human, animal, and environmental health are all interconnected. Addressing complex challenges like antimicrobial resistance requires collaborative efforts and shared responsibility across different sectors. Effective strategies involve coordinated actions and shared solutions between human health, animal health, and environmental sectors. This integrated, multidisciplinary approach is crucial for tackling issues that impact the health of people, animals, and the environment. Antimicrobial resistance is a complex challenge that requires a coordinated, interdisciplinary approach across various sectors: healthcare, agriculture, and the environment. By collaborating, we can share our expertise and resources, promoting knowledge exchange and the development of innovative solutions. Collaborative efforts also foster joint research and development on new antibiotics, diagnostics, and preventive measures. Aligning policies and regulations across sectors is crucial to ensure a unified, effective response to this global threat. Through this collaborative, cross-sectoral approach, we can tackle antimicrobial resistance more comprehensively and make meaningful progress. Regulatory frameworks are critical for addressing the global challenge of antimicrobial resistance. Strong oversight of antimicrobial use in humans, animals, and agriculture can promote responsible usage and mitigate the development of resistance. Robust surveillance systems are essential for tracking resistance patterns and identifying emerging threats, so we can respond quickly. Rigorous licensing and approval processes for new antimicrobial drugs ensure they are safe and effective. Effective enforcement mechanisms are crucial to ensure adherence to regulatory standards and deter noncompliance. By strengthening these key regulatory components, we can make significant progress in combating antimicrobial resistance. Poverty and lack of access to healthcare services can contribute to the spread of antimicrobial resistance. Limited access to antibiotics and poor sanitation practices facilitate the transmission of resistant pathogens. Educating the public and healthcare professionals about antimicrobial resistance is crucial. Raising awareness can help promote the responsible use of antibiotics and prevent the further development of resistance. Key strategies include public awareness campaigns and training programs to ensure proper antimicrobial stewardship. This is an important step in addressing the socioeconomic factors that contribute to the global challenge of antimicrobial resistance. Public awareness and behavior change are crucial in addressing the challenge of antimicrobial resistance. We need to educate the public about the dangers of antimicrobial resistance through educational campaigns and public health messages. Encouraging individuals to use antibiotics responsibly, only when necessary, completing the full course of treatment, and avoiding sharing antibiotics with others is key. Promoting good hygiene practices like hand washing, safe food handling, and other measures to prevent the spread of infections can reduce the need for antibiotics. By raising awareness and changing behaviors, we can make significant progress in tackling the threat of antimicrobial resistance. National action plans outline strategies and goals for each country to combat antimicrobial resistance within their borders. These plans address key areas like surveillance, stewardship, and infection control. International organizations like the WHO are coordinating global efforts to combat antimicrobial resistance. They provide technical guidance, support research, and promote collaboration among countries. Combating antimicrobial resistance requires a global approach and cooperation among countries, organizations, and individuals. International cooperation is crucial for sharing knowledge, resources, and best practices. The world map on this slide highlights the global challenge of antimicrobial resistance, with areas of varying severity shown in different colors. In the center is a stylized graphic of a bacteria representing the threat posed by drug-resistant pathogens. Despite the complexity of this issue, we are seeing progress in the fight against antimicrobial resistance. Advances in diagnostics, drug development, and phage therapy offer hope for new tools to combat resistant infections. Increased global collaboration, knowledge sharing, and awareness are vital to tackling this challenge. However, significant challenges remain, including funding gaps, resistance to change, and socioeconomic factors that enable the spread of resistant microbes. Antimicrobial resistance is a critical global health challenge that requires a coordinated response from all stakeholders. Governments, healthcare institutions, researchers, and individuals must work together to address this threat. A multifaceted approach is needed, combining policy changes, scientific research, and public awareness efforts. By uniting our efforts, we can combat the spread of antimicrobial resistance and protect public health worldwide. This slide sets the stage for the presentation, highlighting the urgent need for global collaboration to tackle this important issue.